Come in.
Hi there. My name is Emily Ramirez. I'm going to be the nurse for today. Can you just verify your name and date of birth for me?
My name is Emma Manson, and my birthday is January 11th, 1997.
Okay, let me just check with my records. All right, everything's good. Before we begin, can you just tell me if your family member is okay to be in this room during the interview? Okay, great. Can you tell me what's going on with you today?
I've been having chest pain.
You've been having chest pain. Okay, and can you tell me, like, when did it start?
It started while I was going on my run in the morning.
You were running in the morning then, okay. And can you tell me anything that makes it better or worse? Have you noticed?
If I relax and like sit down.
Okay. So when you're running, that's when it makes it worse, but when you sit down, it goes down a little bit. Okay, and can you describe this pain for me? Is it like sharp stabbing pain or like a pressure cushion
It's like a
pain?
crushing chest pain.
Okay, all right. And it's I'm sure it's discomfort too, right? Okay. And can you also tell me on a scale of 1 to 10, 10 being the worst pain, can you give me a number?
I would say when it happens, around 7.
7 when you're running. And what about when you rest? What does it go to?
Like a 3.
A 3, so it definitely decreases. Okay. And then does it go anywhere? Does it go to your shoulder, to your stomach,
to my back.
to your back?
Yeah.
Your upper, lower?
My upper.
Your upper back? Okay. And last question. How long has this been happening?
For a couple months now.
For a couple months? Okay. So it is significant. And how long do the episodes usually last? A couple minutes, half an hour?
Around 10 minutes.
10 minutes? Okay. Now I would like to ask you 3 questions just to check your mental status. Is that okay with you?
That's fine.
Okay, so my first question is simple. Can you just tell me the name of your family relative that's here with us?
This is Monica, and she's my sister.
Okay, great. Hi, Monica.
Hi, how are you?
Good. Thank you for coming along.
No problem.
And now my second question. Can you tell me today's date?
October 25th.
October 25th. Great. And then lastly, do you know where you are?
The hospital.
Hospital. Okay, great. So my patient is alert and orientated ×3. She is well groomed. She is appropriately dressed for today's weather, and she is coherent and she's complying appropriately. All right, Emma, is it okay if I just take a couple vital signs on you right now? Okay, great. Okay, I'm just gonna push up. Can I? Yeah, on this one it'll be easier. All right, great. Okay. Okay, blood pressure is 120/80, so you have a great blood pressure. Okay. And take your temp. Sorry about that. Okay, underneath the tongue. Okay, 98.7. That's great. I'm going to do a quick pulse rate on you, okay? All right, 75, that's great. And I'm just going to observe your respiration, so just breathe normally, okay? Okay, so you're 14 breaths per second, and I just want to take a couple sounds of your respiration. Is that okay? All right. Just take deep breaths for me. Again. Again. Okay. All right. So your vital signs seem to be okay. At this moment, I'm just going to check my medical records to see what the provider has ordered to give you. Okay. You just came into the ER yesterday, right?
Yes.
Okay. Okay, so I see the provider here has ordered nitroglycerin as needed. So at this time, I'm just going to call the pharmacist to bring in the supply, as well to go over some, side effects and what the drug does. Is that okay?
Yes. Okay. Great.
All right.
Thank you.
Come in.
Hi, I'm
Hi.
Jamie. I'm a pharmacist. I'm going to be explaining today what nitroglycerin does, how it works. If you have any questions, just stop and let me know. Okay, so nitroglycerin is a vasodilator. It works by opening up the veins and allowing more blood flow to the heart and the coronary arteries. So this is going to help with chest pain and angina, and like you said, running. It can help prevent that. So she's going to help you administer the medication.
Okay, so this is what the patch looks like. Okay, I'm just gonna open it up and I'm going to put my initials and the date. So typically we put it like in a hairless area. So you can put it in your arm. Today we're gonna put it in your arm. But you can also do it in the other arm. Just try and not always put it in the same place. I would suggest you write the date on it just so you can remember when to change it up. Also, it would be a good idea to, you should take it off at night, because just so your body won't create that resistance to the medication. Are you understanding? Do you have any questions for me?
I'm sorry, I have questions.
Yeah,
because
sure,
I'm a little
Monica.
nervous. My sister's very young, and this medication is, chest pain is no joke.
I understand, and it's not
My question is, can you overdose on nitroglycerin? Like this patch form, once it's applied?
Can you overdose?
like-
Is that your question?
Yes.
Well, the patch is already, it's set to a prescribed milligram per
Okay.
hour.
Okay.
And I'm just going based on the provider's orders.
Okay.
So this is a good for 24 hours.
Okay.
So that's what I was saying, that she should be changing it up every day.
Okay.
It's a good way to get used to it by changing it up at the same time every day and putting it on at the same time every day. Do you have any other questions?
I do. So how long does she need to wear it, like, before she takes it off? It's just, you said 24 hours, or was it?
Yeah, so like, let's say like if you put it on at like 7 a.m., before you go to sleep, 7 p.m., you could start taking it off.
Okay, so when is like the best time? Is like there a best time that she should apply it, like out of the day?
Well, it depends really on your activity. Let's say like if you're gonna be exerting a lot of energy and a lot of tension on your body, just always remember just to put it on like in the morning, let's say, so you could be good for throughout the day.
Okay, so if she's having chest pain and she applies it, like how long does it take effect once she?
So if she's having a current attack of chest pain, she's not going to want to put it on, because the patch takes around 45 minutes to an hour to work. So if that is an issue where you're still having chest pain, you're going to want to call your provider and see if there's something else we can do, like adjust your medication, something like that.
Okay, so if she has the patch on and she's applying and she's applying it as she should, and she's still having pain, she should just call the doctor like immediately?
Yes, call
And-
us.
Call the doctor, or go to your local emergency room,
Okay.
and then we can adjust like the pharmacist said, adjust the dosage, or maybe we would need to add like something else to her to already the patch.
Okay.
Okay. And do you have any questions yourself as a patient?
Yeah, am I able to wear it into the shower?
Yes. So yeah, the patch you could put it in the shower. It's waterproof, and so you're good with going into pools, going in the shower, or anything like that for now. Okay. So are you ready, Emma?
Yeah, are you going to be applying patch?
Yes, I will.
Okay, because I would prefer if a woman applied patch.
Okay, yes, no, so you don't have to worry, it's just us girls in here, okay? Alright, I'm just gonna roll up your sweatshirt. Apply it right over here. Okay. So we can roll that down. Okay. You're all set. So you will be feeling the effects within maybe an hour or so. So when you're doing all of these activities, you shouldn't be feeling any chest pain. A couple adverse effects, you could feel a little dizzy. You could feel also a little GI issues. Could give you headaches as well. But the main thing to be looking out for is just an increase in that chest pain that you're having. So if you're out there running, you shouldn't be at a level 7 like you said you were. You should be like, maybe a 3 or a 2, very minimal. If you see any severe side effects, like that headache isn't being relieved by, like, let's say just an over-the-counter drug, then I do suggest you call us, and then we will adjust either the dosage, or we can do a nitro chewable tablet or anything else.
Okay, thank you.
Okay, you're welcome.